65-year-old man who came in for some blood work at the hospital, so you passed out for her.
So today we're at UPEI. We're in the simulation lab, and we are going to be running a simulation today with the students. We're running a cardiac arrest, a VFib arrest. We're using a simulator that was purchased through the Research to Action program. One of the benefits of having a simulation like this is that we have the students in a controlled environment.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23.
It's a huge piece for PEI because when students have to leave the province, a lot of times they either A, are not engaged or don't want to go to Halifax, or B, they may end up in Halifax and stay in Halifax.
Before I actually did the course to now, I noticed a big difference, particularly when it comes to anticipating what complications a particular patient might run into. And it's constantly monitoring what might happen instead of just treating what the patient's in with. Specifically, if a patient's in with a heart attack, well, now I know, okay, well, this is the part of the heart it affects, and they might run into X amount of complications with that particular heart attack.
So I think this course is a critical piece of recruitment and retention for RNs. I work with a lot of younger nurses, and I know we all want more education, but I think that's a critical piece of getting the nurses that we train here and that go through our program at UPEI. I think we'd like them to stay, and I think that this is a really critical piece. I've had a lot of my co-workers, since I've been back in the clinical area, they've been asking lots of questions about it, very interested. There's a big appetite for education out there, and it's very difficult sometimes to get away when you're in the clinical setting. It's a little harder to always get the education that you want. So I think there's a huge benefit. I think our patients and clients will really benefit from the additional training that we've received.